The ambulance doors burst open at 11:47 p.m., and the fluorescent lights of Mercy General's emergency room flooded over a stretcher, carrying what the paramedics had quietly described over the radio as a difficult one. Staff Sergeant Marcus Hale, 34 years old, decorated twice for valor in 2 separate deployments, and now 4 months removed from his final tour in a country whose dust still lived in the creases of his knuckles, was brought in not because he had asked to be, but because his landlord had heard him screaming through the walls for the 3rd night in a row and made the call himself. He was conscious. That was the first thing Nurse Diane Kowalski noticed. Conscious and furious about it. "I don't need this," Marcus said, the words grinding out between clenched teeth. His jaw was set the way a man sets his jaw when he's decided that showing pain is the same as losing a war. His left arm was cradled against his chest. A flare-up of the shrapnel injury that had partially ended his career, the scar tissue around his shoulder having locked up again from tension, from nightmares, from sleeping on a floor because beds had started to feel like coffins. His blood pressure read 158/104. His hands hadn't stopped shaking since the paramedics had strapped him down. Diane, who had worked the night shift at Mercy General for 11 years and had cared for more veterans than she could count, approached him with the steady calm of someone who had learned that urgency, in certain cases, looked exactly like stillness. She was 42, blonde hair pulled back, a small silver cross at her collarbone. She had a son in the Marines. She understood, in the cellular way that only people who love soldiers can understand, the particular shape of this kind of suffering. "Sergeant Hale, I'm Diane. I'm going to take care of you tonight." "No, you're not." He didn't look at her. His eyes were fixed on the ceiling tiles, tracking something that wasn't there. "I'm fine. I want to go home." "Your blood pressure says otherwise." "My blood pressure isn't your business." She didn't flinch. "It is, actually. That's the job." She reached for his wrist to check his pulse manually, the way she preferred, and he pulled his arm back so sharply the 4-line tugged and bled a small red thread into the tube. "Don't." The word was a wall. Diane stood back. She had learned, years ago, that the worst thing you could do with a man like Marcus Hale was fight him for control of the room. He had spent years in environments where surrendering control meant dying. His nervous system didn't know it was safe. His body was still at war, even if the war had technically ended. She made a note in his chart, adjusted her approach and gave him space, 3 feet of it, which in an ER bay was practically a luxury. Over the next hour, 3 more nurses tried. Kevin Bradshaw, the charge nurse, calm and methodical with 15 years of trauma experience, came in with a blood pressure cuff and got as far as good evening before Marcus told him, with the precise coldness of a man who had been trained to intimidate, that he could take his cuff and leave. Kevin left. Trauma nurse Stacy Lennon, who specialized in PTSD cases and had taken 3 additional certification courses to better serve veteran patients, sat beside his bed and tried a grounding technique. "Name 5 things you can see," and Marcus turned his face to the wall and said nothing until she quietly excused herself. Even Dr. Paul Whitmore, the attending physician, a calm, silver-haired man who had served 2 years as a Navy doctor and who spoke the language of military bearing with natural fluency, found himself standing at the edge of Marcus's bed, receiving a look so hollow and hostile that he took a breath, told Marcus he would check back in 20 minutes, and stepped into the hallway to call psychiatry. The ward buzzed quietly with the particular exhausted energy of a hospital past midnight. Machines beeped. A television somewhere played the tail end of the late news. A baby cried in the pediatric bay 2 curtains down and then went suddenly, mercifully quiet. No one knew what to do with Marcus Hale. He had been flagged in the system before, 2 previous ER visits in the past year, both ending in him leaving against medical advice, signing his own discharge papers with the mechanical precision of a man who had signed 100 forms that meant 100 kinds of danger. Each time, the staff had documented: uncooperative, resistant to treatment, agitated, hypervigilant. The language was clinical and accurate, and it said nothing true about the fact that this man was drowning, slowly, in a life that had stripped away every context in which he had known how to survive. He had been good at war. He had been exceptional at it, in fact, decorated, respected, the kind of soldier younger men looked at with a quiet reverence that he had never asked for and never known how to carry. He had kept people alive. He had made the hard calls that kept the body count lower than it could have been. He had done his job with a discipline so total it had become indistinguishable from identity. And then the job had ended, and he had come home to a country that was peaceful in a way that felt, to his rewired nervous system, not like safety but like a lie. He had come home to an apartment that was too quiet and a family that didn't know how to talk to him anymore and a VA appointment backlog that stretched 4 months into the future. He had come home and found that the man who had been forged in the specific crucible of service had no instruction manual for what came next. So he lay in the ER bed, his jaw locked, his shoulder burning, his blood pressure a ticking clock, and refused every hand that reached toward him. Not because he didn't need help, but because needing help, for Marcus Hale, had always been the most dangerous thing in the world. None of that was about to change. Until the janitor came in to mop the floor. His name was Robert Bobby Callahan, and he had worked the overnight janitorial shift at Mercy General for 6 years. He was 58 years old, lean in the way that men get lean after decades of physical work, with a white crew cut so precisely maintained it could have passed military inspection. His hands were large and weathered, the knuckles slightly swollen from old injuries and older weather. He wore the gray uniform of the hospital's facilities staff and moved through the corridors with an unhurried efficiency that made him almost invisible, which, in a hospital, was often exactly the point. Bobby pushed his mop cart through the ER with the practiced routine of a man who had long ago made peace with the fact that his job was to come in after everything else had already happened. He cleaned around gurneys, worked his way around the edges of family conversations he never listened to, navigated the organized chaos of the night shift with a quiet nod here, a polite step back there. He was not a man who drew attention. That was also, in some ways, the point. He turned into Bay 7 at 10 minutes past midnight, knocked twice on the metal frame of the curtain track the way he always did, courtesy, always even in empty rooms, and pushed through to find Marcus Hale lying rigid on the bed, staring at the ceiling with the fixed focus of a man trying to hold himself together through pure concentration. Bobby took one look at him and stopped. Not because Marcus was visibly injured. Not because the vital signs monitor was beeping with mild urgency at the edge of the bed. He stopped because he recognized something in the posture, in the locked jaw and the controlled breathing and the way the man's hands were gripping the bed railing, that he had not seen in 30 years but had never once forgotten. It was the look of a man running battle drills inside his own head, fighting an engagement that no one else in the room could see. Bobby had worn that look himself. He didn't say anything right away. He started mopping. He worked the far corner of the bay first, slow and methodical, the mop head moving in the wide figure eights that covered ground efficiently without splashing. He didn't look at Marcus, didn't address him, didn't perform the careful, therapeutic attention that Marcus had spent the last hour rejecting like a foreign body. He simply did his job, the way he had always done his job, quietly and without need for acknowledgement. Marcus watched him from the corner of his eye. A minute passed. 2. The monitor beeped. The mop moved. Bobby rinsed the mop head in the bucket and kept going, working his way closer to the bed. Still not looking. Still not speaking. Then he paused, reached into the pocket of his uniform jacket, and set something small and metallic on the bedside table without a word. He went back to mopping. Marcus turned his head. It was a challenge coin. Old one, by the look of it, the edges worn smooth, the enamel slightly faded. 3rd Ranger Battalion, 75th Ranger Regiment. The motto in a circle around the edge, SUA Spont. Of their own accord. Marcus sat up so fast he pulled the 4-line again. Where did you get that? His voice was different. Not the cold, controlled hostility of the past hour, but something raw under it. Something that had been punched through the armor. Bobby stopped mopping. He turned around slowly, no drama in it, and for the first time looked Marcus directly in the eyes. He had blue eyes, very steady, the kind that had seen enough to stop being startled by most things. Fort Benning, Bobby said. 1987 to 1993. The room changed. Marcus stared at him. The monitor kept beeping. Somewhere down the hall a phone rang twice and stopped. Marcus looked at the coin on the table and then back at the man holding the mop, and something in his face did something it had not done in months. It moved. A shift, barely visible like the first crack in ice. Not softness exactly. Something older than softness. Recognition. You were a ranger, Marcus said. Was. Bobby said it without apology or inflation, the way men say things that were once enormous and have since become simply true. 2nd Battalion, back when we were still at Harmony Church. Before your time. He tilted his head slightly, reading the residue of Marcus's military bearing the way veterans learn to read each other. 75th? Marcus hesitated. Then, 3rd Bat. 2 deployments Afghanistan, 1 Iraq. Bobby nodded. He didn't say thank you for your service. He didn't say that must have been something. He didn't say any of the things that civilians said that landed wrong in the chest of a combat veteran. Sincere as they were. He just nodded, one slow acknowledgement, the kind that meant I know what that cost. The kind that could only come from someone who had paid something similar. Shoulder? Bobby asked, glancing at the way Marcus held his left arm. Shrapnel. 2019. Flares up. Marcus paused. They want to put me on a drip and I'd rather burn the building down. Bobby almost smiled. It was a restrained thing, barely visible at the corner of his mouth. IVs feel like restraints, he said. It wasn't a question. Marcus's eyes sharpened. Yeah. I used to tell them to tape it to my arm instead of strapping it down. Less contact on the wrist. Helps. He shrugged one shoulder. Sometimes. Marcus looked at the 4-line. He looked at Bobby. The ice cracked a little more. They send you in here to soften me up? There was no real edge in it now. It was almost a joke, which was almost a miracle. Son, Bobby said, picking the mop back up. They don't tell me anything. I'm the janitor. And this time, for the first time all night, Marcus Hale made a sound that was not quite a laugh, but was the thing that lives right next to a laugh in the place where a man's armor has a seam. Bobby Callahan had not planned to stay. His shift ran from 11 to 7, and Bay 7 was the 8th stop on his nightly circuit, slotted for approximately 12 minutes including corner work and baseboard wipe down. He was not a counselor, not a chaplain, not a trained mental health professional. He had not taken the additional certification courses that Stacy Lennon had taken, had not read the literature on veteran PTSD that Dr. Whitmore kept in a binder on his office shelf. He was a man who cleaned floors and he was good at it, and that had always been enough. But he pulled the plastic chair from the corner of the bay, the one that family members used during visits, slightly cracked along the seat from years of hard use, and sat down in it and set the mop against the wall, and because Marcus hadn't told him to leave, he stayed. They didn't start talking about anything important. That was not how these conversations worked, and both men knew it, the way men who've served know 100 things without ever having been taught them directly. Bobby asked him what unit he'd been with when the shrapnel hit. Marcus told him. A compound in Kandahar province. A morning that started like every other morning and then rearranged itself into something else. Bobby asked no follow-up. He absorbed it and moved on, asking instead about the platoon, about who Marcus had served with, small logistical questions that were really questions about whether you had people, whether you were held, whether when it all went sideways there had been someone beside you. Marcus answered. Slowly at first, in the clipped responses of a man who had forgotten he was allowed to use more than a sentence at a time. Then, gradually, in longer ones. My squad leader was a guy named Tony Ferris, Marcus said. From West Virginia. Big guy. Couldn't parallel park a car to save his life but could move through vegetation in the dark without making a sound. Lost him in 21. He stopped. His hand had released the bed railing at some point without him noticing. It rested flat on the blanket now. I still hear him sometimes. In the apartment. Like he's around the corner. Bobby didn't offer comfort. Didn't pivot to a hotline number or a coping strategy. He sat with it the way the man had asked to sit with something enormous without having it immediately taken away. I lost a guy named Denny Marsh, Bobby said. Panama. 1989, just cause. He said the operation name the way veterans say operation names, without glory, without the shorthand of history, just as a marker of time and place. He was from Minnesota. Played guitar. Bad at it. A pause. Hadn't thought about his guitar in years until just now. Marcus looked at him. Does it get quieter? Bobby considered the question with the seriousness it deserved. He didn't rush the answer. The monitor beeped twice, slow and steady. Down the hall, the hospital moved through its midnight rhythms. Not quieter, Bobby said finally. More familiar, like living near a train track. At first it wakes you up every time. Eventually you hear it and you just know, that's the 2 a.m. train. And it's going somewhere else. Marcus was quiet for a long moment. Something in his face was working. Not toward tears, not toward anything dramatic, but toward a reckoning of the private kind that happens when a man hears a thing said precisely right for the first time. I haven't told anyone about Tony, Marcus said. Not my sister. Not the VA guy. When I finally got an appointment 3 months in, I sat there for 50 minutes and talked about my shoulder. He looked at his hand. Talked about the physical stuff. Felt easier. Physical stuff has a fix, Bobby said. Or at least an explanation. Body language is easier than the other kind. Yeah. Marcus exhaled. A long, slow release, the kind that suggested the breath had been held for some time. Weeks, maybe. Months. I don't know how to explain the other kind. You don't have to explain it. You just have to stop carrying it alone. It was not a revolutionary thing to say. It was, in fact, the kind of thing that appeared on motivational posters in the very VA waiting rooms that Marcus had sat in without speaking. But there is a difference between a thing being said and a thing being said by someone who has earned it, who has walked the same roads and paid the same prices and come out the other side holding a mop instead of a medal and found a way, quietly and without fanfare, to keep going. Marcus heard it differently. The words landed in a different register. Around 1:15 a.m., without any particular ceremony, Marcus Hale said, "Okay." Bobby looked at him. "Okay what?" "The 4. The drip. Tell them they can. Tell them to tape it. Like you said." He paused. The admission cost him something, and he knew it, and he paid it anyway. "And I'll let them take the blood pressure reading." Bobby stood, picked up the mop, said nothing about what had just happened, which was exactly the right thing. He went to the curtain and called down the hall for Diane. She came quickly, her face professionally composed. The seasoned nurse's ability to show nothing while feeling everything working at full capacity. She caught Bobby's eye for a half-second, a glance that asked a question, and he answered it with the smallest nod. She went to Marcus. He didn't say good evening, and she didn't try to explain herself. She picked up the 4 line and began taping it to his forearm instead of his wrist. Her hands were efficient, sure, practiced. "This okay?" she asked, not looking up. "Fine," Marcus said. His voice had lost some of its calcification. It sounded tired now, genuinely tired, not armored tired. The tired of a man who is close to sleep for the first time in a long time. She took the blood pressure reading. 141/92. Still high, but moving in the right direction. She noted it in the chart and stepped back and told him that Dr. Whitmore would check in at 2, and that there was no rush. When she turned to leave, she paused at the curtain and said, quietly, to the space between the 2 men, "Thank you, Mr. Callahan." Bobby was already pushing the mop cart toward Bay 8. He raised one hand, not quite a wave, just an acknowledgement, without turning around. He had a floor to finish. 6 weeks later, Marcus Hale came back to Mercy General. Not in an ambulance this time. Not with a landlord's frightened phone call behind him or a blood pressure reading that read like a countdown. He walked in through the front entrance on a Tuesday afternoon in a clean flannel shirt, his left arm moving more freely than it had in months. Physical therapy twice a week, which he had committed to after the ER night with the specific grim determination he applied to anything he decided was worth doing. He had a VA appointment now, a real one, with a counselor who was also a veteran, a compact woman named Janet Reyes who let silences exist in the room without filling them and who had, over the course of 5 sessions, been slowly handed pieces of a story that Marcus had not told anyone. He had not become a different man. That was not how it worked, and he knew it. He still woke at 2 a.m. sometimes, heart hammering, reaching for something that wasn't there. He still had days where leaving the apartment required more activation energy than he could honestly justify to himself, where the noise of traffic on the street below read as threat before his prefrontal cortex caught up with his amygdala. He still heard Tony Ferris sometimes, not as clearly, maybe a little more like the 2 a.m. train. He asked the woman at the front desk where he might find Robert Callahan. Facilities, overnight shift. She looked up his schedule. Mr. Callahan comes in at 11, she said. But he usually stops by to check on a few things around 3:30 in the afternoon. You could try the facilities office on B level, or... I'll wait, Marcus said. He sat in the waiting area with a cup of coffee from the vending machine and watched the hospital move through its afternoon routines. Families came and went. A child in a superhero cape ran down the hallway pursued by a laughing nurse. An old man in a wheelchair was pushed slowly past by a woman who might have been his daughter, their hands interlaced. Marcus watched all of it with the particular attention of a man who was learning, slowly, to see ordinary things as what they actually were instead of as cover, exit points, potential threats. He thought about Tony Ferris. About the way Tony had eaten peanut butter straight from the jar with a tactical spoon he kept in his kit and claimed had multipurpose value, and nobody had ever argued with him about it. He thought about the way a man's laugh could occupy a space so completely that even years after the man was gone, the space still remembered the shape of it. He sat with that and didn't rush it away. Bobby arrived at 3:40, coming through the side corridor that led from the parking garage to the B-level facilities office. He was in civilian clothes, jeans, a work jacket, a thermos of coffee, and looked like what he was outside this building. A man in late middle age going about a life that had been assembled from the pieces available. He almost walked past the waiting area before something made him glance sideways. He stopped when he saw Marcus. Marcus stood. He had the challenge coin in his hand. Bobby had left it on the bedside table that night and Marcus had pocketed it before discharge. Not sure why, some instinct. He held it out now. "You left this," he said. Bobby looked at the coin, then at Marcus, and the same restrained almost smile from Bay 7 appeared at the corner of his mouth. "Keep it. It's yours." It was. "Now I'm giving it to you." He took a sip from his thermos. "How's the shoulder?" "Better. PT is..." Marcus considered the word. "Helping." Bobby nodded. "And the rest of it?" A pause. Not an evasive one. A real one, the kind that means a man is choosing his answer honestly instead of reflexively. "I found a counselor," Marcus said. "Veteran. She doesn't try to fix it too fast." He looked at the coin in his hand. "I've been going." Bobby looked at him for a long moment with the steady blue eyes. "That's the hardest part," he said. "Deciding to go. Everything after that is just showing up. Someone told me to stop carrying it alone." "Sounds like a smart guy." "He was a janitor," Marcus said. And this time the thing that lived next to a laugh came all the way through. And it was a laugh short and rough-edged, shaped by years of disuse, but genuine, arrived at honestly. Bobby responded with one of his own, and for a moment two veterans stood in a hospital waiting room laughing about nothing in particular, which is sometimes the closest thing to everything. They stood talking for 23 minutes. About the army, about the gap between who you were in it and who you were asked to be after it. About Bobby's 6 years at Mercy General and the way the overnight shift suited him. The quiet, the lack of performance, the satisfaction of a clean floor. About Marcus's sister in Columbus who had started calling again, carefully, and how he had started answering. About the particular texture of grief for people who die in service, how it never metabolized the way other grief did, how it sat in the body differently. No one from the hospital staff saw them as anything other than two men talking in a corridor. Which was all they were. Which was also, in the way of plain things that carry great weight, enormous. When Bobby said he needed to head upstairs, Marcus shook his hand. A firm, full grip, the kind that means something. Bobby clapped him once on the good shoulder, not roughly. "You doing okay?" Bobby asked. Plain question. The real one. Marcus thought about the apartment that was slightly less like a bunker than it had been. The physical therapist who had shown him that his shoulder could be trusted again, incrementally, with patience. Janet Reyes and the silences she let live. His sister's voice on the phone on a Sunday saying, "I made too much chili, you should come over." Tony Ferris, whose laugh still lived somewhere in the rooms of him, no longer as a wound but as a kept thing, carried carefully. "Getting there," Marcus said. Bobby nodded. It was enough. He went up the stairs to start his rounds, thermos in hand, unhurried, doing the job the way it had always been done. Quietly, without need for recognition, of their own accord. Marcus stood in the lobby and turned the challenge coin over in his fingers. Sua spont. The words worn smooth but still legible, still true. Of their own accord. The Ranger motto. The belief that the right thing done is most powerful when chosen freely, without being ordered, without an audience, without expectation of return. He closed his hand around it. Outside, the afternoon was ordinary and lit and full of the kind of life that had always been waiting, that would keep on waiting, patient as a clean floor, for as long as it took a man to find his way back to it. He walked out into it,